radial nerve upper limb neurodynamic tension testing. Patient currently is lying straight down the middle of the plinth. I'm going to have the patient lie in a diagonal with his shoulder slightly off the table. The reason is I'll be using my hip to add a little bit of tension through the shoulder girdle. Again, I've already done the passive neck flexion and adding the passive neck flexion with a little bit of the side bend. Here, I'll take the patient's arm. Patient is passive. This entire sequence is passive. And at each segment, as I add each component, I'll ask the patient if any of his symptoms have been reproduced or what he feels, what level of intensity, and ask him to point out where he is feeling it. So starting right here. Any problems here?
No.
Adding elbow extension. Any problems here?
No.
Adding full humeral internal rotation, as you can see. Any problems here? Again, I'm trying to keep all the segments locked. Elbows extended. Keeping the segments locked. Put your thumb in your fist for me. Any problems there?
No.
Adding a little bit of wrist flexion and ulnar deviation. Any problems there?
No.
Okay, if the patient complains of no symptoms here, you can slowly abduct the arm. Okay? Patient complains of symptoms.
Yes.
Where do you feel it and what level?
My thumb.
Feel it in his thumb.
And about 3.
Okay, and a 3 out of 10. And to see if you can change those symptoms, you release pressure off the shoulder girdle. What happens to the symptoms?
Back down to like 1.
Okay. And so you've changed distal symptoms with some proximal adjustment of the shoulder girdle. This will imply some type of neurotension within the system. Take the patient back to neutral.